How is everybody? Fantastic. Thank you so much for coming out at 8:30 in the morning on a Saturday to focus on this incredibly important topic. Another story from my family, Palo Alto Medical Foundation literally saved my mother-in-law's life. Sent her cancer running for the hills, never to come back. And in a sense, I'm actually even more impressed that you are now holding a hackathon on successful aging. To me, that actually exemplifies the best of where the healthcare system needs to go. And I'm so appreciative, and so many of us are so appreciative that you're doing this. So what I'd like to do actually is talk a bit about how the US Department of Health and Human Services, the US government, has now fully embraced the whole idea of open data and open innovation to improve health and healthcare. It's a big, big deal for us, and we're dedicated with every fiber of our being to helping to support and catalyze that across the country through efforts like this one. So let me actually just give you a bit of background about what my job is. What my job was at HHS, what my job is now. I was actually a private sector entrepreneur before I actually joined HHS, co-founding 3 companies. In fact, when HHS first called me and said, we're interested in you becoming our chief technology officer, I actually said, why are you calling me? I don't know anything about government. I've never worked in government at any level. And they said, that is exactly why we are calling you. Because this job is not what you think it is. It's not the dude who has to run all IT at the US Department of Health and Human Services. It's actually a brand new job that Secretary Sebelius has created, who's supposed to be, with 100% of his or her time, an internal change agent, who's dedicated to working with the best innovators inside and outside government to invent and then execute at high speed new initiatives that harness the power of data, IT, and innovation to improve the health of the American people. He said, it's our tech entrepreneur in residence. At which point I said, what? You're hiring a tech entrepreneur in residence? They said, yes. I did my due diligence, and actually they were completely serious. They really wanted to establish the position. The secretary wanted to work very closely with this person, along with the whole leadership team. I remember actually talking to my wife, because I was actually retired at that point. I had become a functional husband. We had a baby, which was fantastic. I had co-founded 2 other companies in my retirement, but I wasn't running them. So my wife was very happy with me for the first time in like forever. And then I actually told her about this thing happening in DC. We actually were living in Los Altos Hills at the time. And she said, what? And she was so angry at me. But 4 days later, she said, you know what? If they're actually creating a tech entrepreneur in residence job at HHS, it is your national duty to do that job. I said, well, I'm not moving to DC without you. She said, no, I know. I'll move back to the East Coast, which I hate, and I'll lose you to workaholicdom again, because you have to do this. So because of her, 2.5 years ago, I moved to DC, became HHS's tech entrepreneur in residence, and the next 2.5 years were the most entrepreneurial experience of my life. The most entrepreneurial experience of my life. And what I'm actually going to talk to you today about is a big reason why. And it's actually an initiative, the Health Data Initiative, that now that I'm the president's tech entrepreneur in residence for the whole US government, I'm going to keep championing, because health is a major priority for this president. We're going to keep rocking and rolling to make as big a difference as we possibly can. So I'd like to talk a bit about this Health Data Initiative, which is one of the kind of virtual startups, it's not a company obviously, but projects, initiatives that I started at HHS and continue to champion as US CTO. Who here has heard about the Health Data Initiative, by the way? Wow, okay. So I'll actually try to make this a high ROI conversation for both folks who have heard about it and who haven't. I'll give a primer about it that's basic, but also add updates for folks who haven't heard about it. So Health Data Initiative in a nutshell is data liberación. It's the whole idea that if you actually open up data and let lots of other people who are incredibly smart use it, you do a lot more good than if you just try to keep it to yourself and build stuff with it yourself. So a model for this initiative is what the government did with weather data about 35, 40 years ago. There's this little agency called the National Oceanic and Atmospheric Administration, NOAA, which you may have heard about, that collects virtually all weather data in America. So it's not like your local newscaster measures barometric pressure himself or herself every morning. They get that data from NOAA. But NOAA, for a long time, has actually done something even more interesting than that, which is that it decided to take all of this data, this weather data, and made it available in electronic form, downloadable by anybody for free, without intellectual property constraint. That's then fed an enormous amount of innovation in the private sector, like weather.com, Weather Channel, iPhone weather apps, weather insurance, and much, much, much more. At no cost to the taxpayer, by the way. Right? Data that's been already paid for is put out there, and then lots and lots of innovators, and no incremental cost, turn it into all kinds of goods and services that help the American people in all kinds of ways and create lots of jobs. The government ran a similar play in the 1980s when it liberated something called Global Positioning System data, GPS data, which comes from the US government. And the release of GPS data in the 80s catalyzed the emergence of everything from Foursquare, right, on your iPhone, to supertanker navigation systems, precision crop farming, et cetera, et cetera, et cetera. Again, huge social benefit, creating lots of jobs. So our thought was, look, why can't we run this play again? Why can't we actually release a whole bunch of data that's been sitting in the vaults of HHS that relates to health, information knowledge about health, make that available to folks who can then turn it into all kinds of awesomeness, all kinds of apps, services, programs, products that can improve the health and healthcare of the American people in all kinds of unimaginable ways. And the underlying principle behind Health Data Initiative is a law that was coined by a famous figure here in the Valley, Bill Joy, the co-founder of Sun Microsystems, who once famously said, no matter who you are, you have to remember that most of the smartest people in the world work for somebody else. Which is, of course, true, right? Always true. So our corollary to that is if you really want to maximize social return on taxpayer investment in, say, HHS data, don't just have HHS's own smart people build tools that are useful with it, right? Make it available to everyone in the world who cares about health and healthcare so they can build tools, they can build magical things that help empower consumers, patients, doctors, nurses, employers, communities, et cetera, to improve the health and healthcare of the American people. So that's the underlying principle. So we've basically been doing three things in this Health Data Initiative. It's a pretty basic play. One, we're publishing brand new data that's never been made available before, either to the public or to qualified external audiences while rigorously protecting privacy, as Paul said. The second thing, it's not as sexy, but it's actually something that's very, very important. We're taking data that we made public in the past, but turning it into something that's truly usable by developers. What I mean by that is a lot of the data that HHS had made public was in the form of books, PDFs, or websites. It was illiquid, right? So if you're a developer in the audience, you would say, well, that's not very helpful to me, right? So what we're doing is we're turning it into what's called machine-readable data, data that can actually be accessed through APIs or downloaded, right, into other third-party applications, websites, and services, and then mashed up with other data and other capabilities to actually make wonderful things happen. Does everyone here know what an API is? The developers do, right? Okay, so for folks who don't know what an API is, an API stands for Application Programming Interface. Right? Think of it as just kind of a port you put on a database that allows the developer to program to it and automatically extract data out of it. If you actually are ever at a party of developers and you want to get really popular really rapidly, say you're going to API something, right? And they'll get very excited because it makes data exponentially easier to work with, right? So that's very important, actually APIing and making data downloadable. And then finally, we realized to our great chagrin, but which actually wasn't in retrospect surprising, that about 95% plus of the developers, entrepreneurs, and vendors in America who could make magical things happen with their data didn't even know what HHS does, let alone the fact that we have all this data, let alone the fact that we're making it available to them. And if you want beautiful things to be built with your data, but nobody knows it's there, will they build beautiful things with the data? Not so much. So we ended up having to do, and we are still engaged in, a grassroots marketing campaign to market the bejesus out of our free data so people could pick it up and build beautiful things with it. So I'll talk more about that in a second. So, but first you might ask, well, what the heck kind of data are you talking about? What kind of data exactly is being liberated? So I want to actually describe maybe a few categories and highlight some examples that may end up being very useful to folks who are actually answering Paul's challenge. So one category is community health data. There's a database called the Health Indicators Warehouse. We actually just published about a year and a half ago or so. And it has over 1,200 indicators of national, state, regional, and county level healthcare system and determinants of health performance. Everything from smoking rates and obesity rates to prevalence of disease in the Medicare population, by region, to utilization of healthcare services, prevention of success, quality success, a lot of determinants of health data, like access to healthy food, air quality, et cetera, which frankly, in a lot of cases, is a much bigger determinant of health than the performance of the healthcare system itself. Available actually as a website, as downloadable files, and as APIs. Another category is a ton of information about healthcare and human service providers, so directories of elder care support services across the country, mental health, substance abuse treatment centers, providers who actually serve Medicare, all kinds of stuff. A ton of information actually about the quality of these providers, which has been made very easily accessible in machine-readable form. We actually have a ton of information about consumer products. So everything from a directory of farmers markets across the country that's actually continuously updated, to insurance, to drugs. We have an API called Pillbox, which has structured information registered with the FDA about every pill and tablet. And on top of that, high-resolution images of those pills and tablets, which you can imagine being very interesting in a lot of different cases. We have an API called clinicaltrials.gov, which is inventory of every clinical trial happening in America and many countries around the world. We've got an API called Medline Plus Connect. Have you heard about this, Medline Plus Connect? So this actually ended up being very useful to you. Medline Plus Connect, there's a site that the National Library of Medicine runs called Medline Plus. And it's a super comprehensive patient education site. It's got information about basically every health and medical topic in the universe translated into a language that patients can understand. And it's updated all the time. Medline Plus Connect is a new service that's got set up. It's free, where any developer, any software program, any electronic health record, post-health record can actually query Medline Plus Connect and say, I've got a person with this medication, this diagnosis, this lab test. And Medline Plus Connect will then spit back a customized patient education package that's electronic, that's tailored for that specific situation. It's basically mapped all this content to individual diagnoses, medications, and lab tests. And that can be injected real-time into the workflow of your personal health record, your linkages, network, your electronic health record, et cetera. So it's basically machine-readable patient education information that's customizable, mass customizable to given situations. Have you heard about Blue Button? OK, so those of you who haven't, Blue Button is an initiative that was launched by the Veterans Affairs Department, the Department of Defense, and Medicare about a year and a half ago. And it's a very simple idea. It's a very simple initiative. What happened is that we implemented the ability for any veteran, any member of the military, or any senior Medicare beneficiary to go to a secure website, authenticate themselves, and then hit a blue button to download a copy of their own personal health information. So in the case of the VA and the DoD, it's your personal health record, because the VA and DoD run big healthcare systems for members of the military and veterans. And for Medicare, it's actually a copy of your own claims data. Now, what was interesting, actually, about Blue Button is that we weren't entirely sure how thoroughly it would be used, how broadly it would be used. In fact, Secretary Shinseki, who was the Secretary of the VA, was told that if we were a breakout hit that maybe 25,000 veterans, we can imagine, would choose to download a copy of their own data. Well, it turns out, actually, that with virtually no marketing, because most people still don't know about it, in about a year and a half, over 750,000 veterans, members of the military, and seniors have chosen to download a copy of their own data multiple times each. And it's actually starting to spread and grow at an increasingly rapid rate. That actually has been copied. The Blue Button capability has been copied now by a bunch of private sector organizations as well. In fact, when we actually did Blue Button, one of the first questions we got was from the private sector, who actually said, "Are you allowed to do that?" We said, "Can you clarify your question?" They said, "Are you allowed under the HIPAA privacy laws to let patients download an electronic copy of their own information?" We said, "Yes, you are." Yes. And so that having been clarified, Aetna has done it, United Health is doing it, Walgreens is doing it, McKesson has done it, Indiana's doing it, Vermont's doing it, Louisiana's doing it. There's even a fan site, which you should check out, called bluebuttondata.org. That was started by the Robert Wood Johnson Foundation, which explains how you, too, can liberate your own customers' data and give them a copy of their own data, understand the privacy policy you have to implement to do that responsibly, and sign up to do it. And if you're a developer, you can actually get a sample of the Blue Button file, a dummy file, to understand how to parse it and integrate it potentially to something like linkages. So that's very, very exciting. So I can go on and on and on and on, but the point is there's a ton of data out there that actually is now machine readable, electronic, available to you for free. And since it's actually hard to keep track of all of it, even the few examples I've actually said it's hard to keep track of in my own head, go to healthdata.gov, which is a one-stop shop for all of our free data. And you can see just tons and tons and tons of stuff in there, everything from this farmers market database to Medline Plus Connect, to directories of services, so on and so forth, that you can actually use in the ingenious stuff that I'm sure you are going to build. One thing you'll not find there is Blue Button, because Blue Button obviously, it's not like you or I can go get Mrs. Jones' data, right? That would be really bad. So Mrs. Jones can go to my HealthyVet or my Medicare.gov to authenticate yourself and get a copy of your own data. But if you actually want to get a dummy file format to learn how to parse this data on behalf of your customers, then go to bluebuttondata.org. Okay. So that's actually happening. But again, we've learned that if you just liberate the data by itself, but nobody knows it's there, people ain't going to build stuff with it. So we've engaged in a campaign of challenges, hackathons, meetups, and data paloozas to get the word out about our data. This is actually pretty new for us. The US government really isn't that, used to doing hackathons, challenges, data paloozas, and meetups, but it's working incredibly, incredibly well. I just want to tell you a few stories of some of these, just to hopefully help inspire you that this stuff can actually spark a ton of incredible innovation. So everyone here knows what a challenge is, right? A public competition that you issue that challenges anyone in America to build something, right? Yes? Okay, awesome, because you're all here, right? So by definition. So a whole bunch of these challenges have actually been put out, not just by us, but by companies and foundations, to leverage data and other capabilities in meaningful ways to do great things for the American people. There's a site called health2challenge.org run by our partner Health 2.0, where you can see a lot of these challenges. You can actually see what people have built in these challenges. Very, very exciting. Hackathons or codathons are, of course, challenges like today, where you really kind of try to compress the dynamic of a challenge into a physical location. Although this is actually kind of a hybrid, right, where you're actually starting with a hackathon/ideathon, then there's a more traditional challenge over 3 months, and then terminating. So you're actually doing the best of both worlds. But I want to tell you a story of actually one hackathon that happened in the past, in the hopes of potentially inspiring you to do something similar. There was a hackathon that Georgetown University held around health data February of last year. And they decided that they were going to hold a hackathon around health data 9:30 a.m. on a Saturday in February. I was deeply, deeply worried about this because A, DC isn't Silicon Valley. B, developers, at least developers I know, don't get up till like noon, right? So kudos to all of you for getting up and showing up here. And thirdly, I just wasn't sure, how many people would hear about this. I was like deathly afraid that I would show up and there'd be like 3 other dudes there, dudes and dudettes, and we'd have a good conversation. But 150 people showed up at this Georgetown Health Data Hackathon, including 5 kids from Pittsburgh, Pennsylvania. Pittsburgh, Pennsylvania. I don't know how they heard about the hackathon, but they actually got really inspired after they heard about it. They bought coats with matching insignia that said Team Maya was their name. They rented a van, got up at Odark 100 and drove however many hours it is from Pittsburgh to Georgetown, DC, for the kickoff of this hackathon. They knew nothing about health and healthcare, had no background in it whatsoever, but they wanted to help. So they actually scrubbed in with a bunch of healthcare experts and health experts at the hackathon, and they looked at our data and learned about this phenomenon called food deserts. Have you all heard about this, food deserts? So if you look at our data, you can see, as clearly as you can see a map of Earth from space, you can see these vast swaths of America where if you live in one of these food deserts, you don't have access to affordable, healthy food. It almost doesn't matter how good the health system is in that area, it's going to be faced with a bunch of problems regardless, right? So there are entire public health symposia about food deserts. There's endless academic literature about food deserts. These kids had not read any of that. They had not gotten the memo about what's impossible. So they decided to solve the food desert problem in 8 hours. And they invented, on the spot, an idea and built the working prototype in 8 hours of something called Food Oasis. Have you heard about this? Food Oasis? So Food Oasis is this, in retrospect, really obvious and brilliant. Many brilliant things are, in retrospect, obvious. Mashup of text messaging and farmers markets. So if you have text messaging, which virtually every American does, including a lot of folks, most folks in low-income neighborhoods, you can access Food Oasis. And what you do is you text in the fact that you want to buy 5 tomatoes and 5 zucchini. And your neighbors do the same. It all goes to a central website, and then a whole system of food suppliers, food co-ops, farmers markets, et cetera, look at all the orders, circle the ones they want to fulfill, hit fulfill, and it texts everybody back, saying show up at St. John's Church from 12 to 3 this Saturday, and I'll have your food. And I am definitely not an expert in the food business, as a caveat, but my understanding is the following. If you do not need a store in the neighborhood, if 2, you know demand 100% in advance, and if thirdly, within 3 hours of showing up, all your food gets bought, the cost of food tends to drop. Who knew? Yeah? So they actually won the hackathon with this, and they actually started to really think about, started to work it over, right? They actually have now decided to turn it into a real company. They're about to announce a partnership with a major American company to turn it into a company and beta test it in multiple American cities. And here's the thing that's really, really exciting about this. So a couple things. One, while these kids knew nothing about health and healthcare, it turns out they worked for a company in Pittsburgh called Maya, which is kind of like the IDEO of Pittsburgh, right? They're ninjutsu-level princes and princesses at something called supply chain management and consumer experience design, which, humble opinion, healthcare could use a lot more of, okay? Right? And so I literally went to visit them in Pittsburgh. They had this whole whiteboard. This entire room, there was one giant circular whiteboard, and they had pressure tested. You know, they laid out a whole kind of series of tests of how they're going to, component by component, hammer this thing until they evolved it into something that really hummed. And the second thing that I got excited about was how excited they were about this. How incredibly excited they were about this idea. There's only one thing I learned as a private sector entrepreneur about entrepreneurship. It's the following rule. If you get the best people, you win. If you don't, you don't. It's the who, right? It's always about the who, because the who will figure out the what and the how. The same thing is true of ecosystems. This is why I'm so excited about today, right? If we can attract more and more of the kick-ass innovators in America to care about health and healthcare, to join arm in arm with the rest of us, right? An ever-growing tide, we will absolutely invent our way out of our health and healthcare issues. There's no problem America has we can't invent our way out of if we try. And these kids, to me, exemplify that. And I'm hoping that out of this challenging codathon, hackathon, 3-month palooza, that there'll be a similar story that emerges that I can actually tell that will inspire people around the country. And so one culmination of all of this activity has been our health data paloozas. Have you heard about this? I would love to feature the winners of this hackathon at one of our next health data paloozas. So the health data palooza is this festival of awesomeness, essentially, that we and a coalition of other folks, like Robert Wood Johnson, Institute of Medicine, are hosting on a regular basis. Next one's actually June 5th and 6th in DC at the Washington Convention Center. And I'll just tell you a story about the last one, just to sort of indicate what's going on, right, and how deep and pervasive this open data, open innovation movement is actually becoming. So last year, we did a 2011 Health Data Palooza, Health Data Initiative Forum, and we issued an open call for any innovator in America, any inventor in America who had actually built a product or service or feature or program using our data to give a presentation, to give a short talk about it in a big forum with Secretary Sebelius and lots of other luminaries. To actually make it into the data palooza, you had to actually meet 2 criteria. One, you had to have built something with the help of our data that helps consumers, helps doctors, nurses, employers, journalists, et cetera, in meaningful ways. And secondly, you had to have a sustainable business model. You had to have something that wasn't a purely academic construct, but that was actually deliverable to real people today. We had a problem last year because way the heck too many people qualified under those criteria for the data palooza. So we ended up doing an American Idol-style bake-off process where people would present over WebEx to a panel of judges and they would score them. And I've told this story a few times, but I was actually not allowed to be a judge. I was allowed to be an observer. And people started calling me Paula Abdul. I don't watch American Idol, but I understand she's very enthusiastic. She loved everybody, wept constantly in joy, got angry at the other judges for being mean. That was me. If that was Paula Abdul, I'm her brother. Yeah, that's what I did. But the other judges were actually much more discriminating. The judges were much more discriminating. So they narrowed it down to about 50 innovations we could manage to fit into our conference center over the course of a day last year, who then gave their talks, presented their innovation. And one of the things we like to say is that if right now, if your faith in America is wavering, even in the slightest, go to the Institute of Medicine's website or Health 2.0's website and find these videos of the June 2011 Health Data Initiative Forum and watch as many of these 50 presenters as you possibly can. Because it is the most incredible display of American mojo I've ever seen. And I can't possibly do justice to all of it, but I want to highlight a few stories to potentially unlock attack patterns in your head as you think about how to potentially help on the problem of successful aging. So there are a whole set of innovations that focused on empowering consumers, enabling consumers to take control of their own health and healthcare. So one example was something called iTriage. an ER doc in Denver, Colorado, who had a lot of experience with folks not being able to get help when they needed it, essentially decided to just take the law into his own hands and started a company and built this amazing product with a team that's a mobile and web app that allows you essentially to kind of tell the app what is happening to you, and it kind of begins to kind of assess your symptoms and then critically finds the best local provider near you who can help you, and then helps you book an appointment with that provider. It's absolutely amazing. And among other things, for example, they downloaded a directory we had made newly downloadable of every federally qualified health center in America. These are community clinics where free and low-cost care is available to anyone, regardless of ability to pay. And within, I think, like less than a year, 115,000 Americans had connected to free and low-cost care at community clinics through iTriage. They did the same thing recently with mental health and substance abuse help. One of the things they did that was so brilliant was they didn't treat mental health as a separate category, as a separate sector of help. They actually surfaced mental health help along with physical health help as a continuum of help for the same person, as opposed to thinking of a person as separately mentally healthy or physically healthy, which is really brilliant, really wonderful. They actually now have over 5 million downloads, I think over 3 million regular users. They're growing like crazy. They hired 67 people last year, so they're creating jobs as well, which is wonderful. You know, it all started with this guy who said, look, I'm just sick and tired of people not getting the help they need in a timely way, right? So another example, which was fantastic, is Healthline. Have you heard of Healthline? It's this company. How many here have used the internet for health search? Okay. So how many here are doctors or nurses who have actually interacted with patients who've used the internet for health search? Okay. So you'll know from both sides of experience, the internet is kind of a good and bad, right? I mean, if you do a search for health topics on the internet, you know, you'll pull up stuff which is alternately potentially great and potentially not so great, and stuff that's even actively dangerous. It's very hard to tell the difference. So what Healthline did is ingested a huge amount of data from the government and other sources to effectively filter what's on the internet to deliver search results that are much more precise, targeted, accurate, and helpful than just the raw internet itself. There are services like Vitals.com that help you shop for the right care by showing you quality, patient satisfaction, and even cost before you actually go. There are services like, have you heard of Asmopolis? Who here has heard of Asmopolis? Asmopolis is a great example, maybe talk about briefly. So it's, again, a single person, David Van Sickle, in Madison, Wisconsin. And he had this brilliant idea, brilliant/obvious. Again, most brilliant ideas are obvious in retrospect. An idea to attach a GPS device to an asthma inhaler and link that to a web app. So every time you use the inhaler, it records when and where your attack happened, and it records a whole map and time series of your asthma experience. So who here actually is a doctor or nurse who's helped someone with asthma? Who here is an asthmatic? So one interesting thing is that people found that asthmatics found it hard to replicate over, say, the last month where and when all their attacks happened. Even the last week. I talked to one of the leading asthma experts in America who has 2 asthmatic children. She said her kids can't even tell her the last time they had an attack and when it happened. If you think about potentially what drives asthma, that's actually kind of important information to know, and we don't know it. So Asmopolis was given to a group of about 80-something asthmatics in an unscientific test, but that was directionally interesting. And they used Asmopolis and shared the data with their doc and nurse partners over several months. The rate of uncontrolled asthma in this population was 75%, which is about the average in the American population of asthmatics. Uncontrolled asthma is defined as you use your inhaler more than 2 days a week. After several months of using Asmopolis, sharing the data, using it, sharing the data, the rate of uncontrolled asthma in this group dropped in half. In half. Now, why was that? It was that if you actually looked at the data in a really user-friendly way, you discovered things about when and where you were having asthma. You discovered that they were happening all at work, for example, right? Or that when you walked past a cement plant every morning. One woman, it's a true story, discovered that whenever she vacuumed her cat, she had an asthma attack. And actually, I'm trying to imagine the chain reaction. Like, you know, 5 o'clock every day in my living room, I have asthma. It's because I'm vacuuming my cat, you know? So, but, you know, so data helps in all kinds of interesting ways. And here's the thing, you know, if you actually bring someone from uncontrolled to controlled asthma, it actually not only keeps someone healthier, it actually reduces cost by about $3,000 to $4,000 per year per asthmatic, which is an economic benefit actually both to society and to the asthmatic who's paying out of pocket, right? Because you're actually not going to the ER. You're not actually experiencing the chain reaction of complication that happens if you have uncontrolled asthma, more frequently than not. And so it's very, very exciting. So this Malcolm is actually now scaling across the country in big installations in Northern California, in North Carolina, Louisville, Kentucky. And it's all started by one person with one very simple idea. Really, really inspiring. There are a bunch of other innovations as well. I don't want to go into a lot of detail because I really want to kind of get into Q&A if that's possible. But there are a whole series of other innovations that were aimed at helping doctors and nurses take the best care of folks. Actually, one of my favorite examples was rolled out by Aetna, of all people. Not necessarily sort of at the tip of your tongue when you think about healthcare IT entrepreneurship, but they're doing a lot of incredibly interesting and innovative things. And one of the things they rolled out at this June 2011 Health Data Palooza was this innovation called a nurse. A nurse. Yeah, so they had actually a person walk on the stage and said, hello, I'm a nurse, and here's what we've done. We didn't actually build like a fancy schmancy iPad app, right, for a consumer directly, although we could have done that. We actually built an IT cockpit for nurses, for 3,000 case management nurses that we employ in call centers across the country who are now working on behalf of docs in accountable care organizations or medical homes, these new kind of care delivery organizations that are really focused on proactive population patient health management, right? These nurses are actually helping these docs proactively keep people as healthy as possible. Interesting stat for you, 5% of the Medicare population accounts for 42% of Medicare spending. They on average have 5 or more chronic diseases at the same time, 5 or more diseases at the same time, and they see 14 different doctors a year. It's a very difficult situation that these folks are in. And their health is massively suboptimized because it's just way the hell too complicated. And stuff gets lost in the cracks, and that leads to complications, ER visits, hospital admissions, readmissions, and even worse. So these nurses are now being assigned to docs to help quarterback these patients so they actually get the right care at the right time and stay healthy. And so the example that they gave was, okay, I'm a nurse. I'm sitting in a call center in New Albany, Ohio. I have just been assigned by a doctor to a 67-year-old who's diabetic, depressed, about to go into renal failure, about to be discharged from the hospital. And what this nurse then did was pull up all kinds of information that allowed her to be, or him to be, incredibly helpful to this patient, saying, you live in a food desert, and I can arrange for Meals on Wheels for you, which I can see in this directory. Here's the local best dialysis center for you. Here's the local best mental health help for you. I'll arrange for transportation services, which I see in another directory. Here's the latest and greatest nutritional counseling for you from USDA. Here's the latest and greatest patient education information from the National Library of Medicine. And to me, the best part of that whole demo, that whole product experience was that the 67-year-old who's diabetic, depressed, renal failure, about to be discharged from the hospital, right, isn't getting that help by flipping around a bunch of icons on an iPad. She's getting that help through one of the oldest and most effective user interfaces ever designed, which is called talking to another human being. So when you think about how to apply this data, don't just think about apps, okay? I love apps. I'm a tech guy, I love apps, okay? But think about how the data can be applied more broadly, in the sense of the word applied, to help inform decision-making and thinking and action at every level of the system to make health and healthcare better, whether it be a patient or a doc or a nurse or a policymaker, a mayor. There are a whole set of other applications and services and products demoed at the Health Data Palooza. They're all about informing county commissioners and mayors about what the heck was going on in their community, giving them situational awareness about where all the food deserts were, so they could potentially change policy to get an oasis planted in that food desert, which would then help a ton of people by giving them access to affordable, healthy food, none of whom had to use an iPad app to do so. So let's think broadly about this and creatively about it. So, and the punchline, actually, for this whole Data Palooza experience, for me anyway, was that HHS built none of these things. We did nothing. All we did was take data that you've already paid for, jujitsu'd it, right, into the public domain, made it machine readable, and let people know it was there. And then American entrepreneurs and innovators did the rest, truly demonstrating that Joy's law is true. Most of the smartest people in the world do not work for you. And you're crazy if you don't harness their power and their creativity to generate magic for the American people. Secretary Sebelius said it best. She said, look, if you look at just these 50 innovations alone that were showcased at the June 2011 Data Palooza, just those alone, no one organization, no 10 organizations could have even dreamed this stuff up, let alone have built and then deployed all of these services to already be helping tens of millions of Americans in ways that we couldn't even possibly imagine. So we are doubling down on health data liberation. Secretary Sebelius is so excited about this, she's actually issued an executive order that tells every HHS agency, NIH, CDC, Medicare, et cetera, to every 6 months publish a data liberation plan as to how they can actually improve access to and the quality of their publicly available data. One of the things actually we're really interested in is feedback, is as you work with our data as part of this challenge and hackathon, tell us what you like about it, tell us what you hate about it. Tell us what we need to actually do better at, make more granular, make more timely, make more available. And we will feed that into our ongoing data liberation campaign. There are more and more challenges, more and more hackathons happening all across the country, most of which, again, we had no part in starting. And we just get called by Paul, we show up, we're so excited. It's incredible. It's incredible. More startups forming, more investment flowing into these startups. Very, very, very exciting stuff. Very exciting stuff. If you're interested in actually seeing a cross-section of all this activity happening nationally, you can come to our June 5th, 6th Health Data Palooza in Washington, D.C. If you go to HDI Forum, hdIforum.org, you can learn more about it and register to come. And I'm actually going to talk this challenge up at the June 5th, 6th forum, and look forward to helping celebrate what pops out of it. And at the end of the day, the deliverable is not liberated data by itself, right? Because data by itself is useless, right? I can't eat data and heal myself. I can't pour data on a wound and have it heal me, right? Data is only useful if it's applied in the context of services, applications, programs in the hands of real people to help improve health and healthcare. So the whole point is to catalyze an ecosystem of innovation, an ecosystem of amazing innovators that's growing and growing and growing, that uses a growing supply of data from us and from lots of other sources to deliver meaningful, tangible benefit to the lives of citizens, doctors, nurses, employers, journalists, community leaders. They all fight and work to improve health and healthcare. An ecosystem that's beautifully chaotic, that's decentralized, self-propelled, and out of control, as all great American ecosystems are. And this ecosystem is already out of control. And we could not be happier about it. And the thing that, if possible, gets me even more excited about this than that, and about days like today, is what this is fundamentally all about. Because it's not about technology, is it? It's not about data. It's about something much, much, much more important. So I have 2 children now, amazingly. One was born 11 months ago. Her name is Diana. She is the happiest, roundest little baby you could possibly imagine. A month after she was born, my wife called me, hysterical, on the way to the ER. I went to the ER. Diana had an echocardiogram, and she was diagnosed with what's called a ventricular septal defect. It's a huge hole in your heart where you're not supposed to have a hole. It used to be a death sentence, a slow, agonizing death sentence. But today, if you get the right care, have the right insurance, you can actually get it fixed. And we were fortunate to actually be in that situation. And she had open heart surgery a few months ago. And knock on wood, appears to be okay. I learned a couple things in this experience. One is I learned in a really visceral way just how important it is to have the right information and the right help at the right time. How important it is for my doctors and nurses and family to have the right information and the right help at the right time. And that the absence of such information and help is not academic. It is the difference between potentially life and death, sickness and health, in a very, very concrete way. And the second thing I learned is a lesson about meaning. So when we have experiences like this, as a lot of us have had, right? When people in general have experiences like this, health experiences in their family, there's a phrase you often hear them say, which is, it gives me perspective. And that's usually code for something like, nothing else really matters. For example, my work doesn't really matter. Well, for those of us who work in the health space, who've had experiences like this, we know that these kinds of experiences really do give us perspective as well, don't they? But it's not what people usually mean. It's not that our work is unimportant. It's that our work is much more important than we could have possibly imagined. Because the point of all this innovation is not to abstractly make cars faster or iPhones more user-friendly. It's to help save the life or improve the life of a baby like Diana, of someone's mother, of someone's father, someone's son, someone's daughter, someone's sister, somebody's brother, somebody's loved one. That is the point of the work that we are trying to do. And as Paul gave his amazing opening talk, I was both thinking about the stats, and I was thinking about my parents. This is personal to all of us and to the lives of people that we love. And I know that many people in this room were working on issues like this long before they were cool, and I thank you profoundly for doing that. All of us do. I thank you even more, though, for what you are about to do in the context of this challenge, in the context of the work we have ahead, in what I think is a moment of profoundly enormous opportunity to evolve our health system to where it needs to go. And I thank you for your work, not as the U.S. Chief Technology Officer, but as Diana's father, as my mother's son. Because I'm quite confident, I'm incredibly confident, that someone in this room is going to invent something that will change the health system for the better. So double down on this work. Do something amazing. Change the course of this country. It is in your power to do it. In fact, you are the only ones who can. If we can do anything to help, let me know. My email address, which I gave out to everyone, is very complicated. It's the White House email address. tpark@ostp.eop.gov, which we'll send out again. I respond to all my own email. If I don't respond within 72 hours, then I have this protocol where please respond back to me again saying, "You idiot, colon," with a subject line. And then I actually sort my Outlook by "you idiot," right? And I get back to everyone. And as I told actually everyone, Tom Getz, executive of Wired Magazine, has passed on a hack, which is that if you put "you idiot" in the first email, then you save yourself 3 days of me not getting back to you. So feel free to do that. And don't be worried about offending me, because if I didn't get back to you, then I could have helped you as you do amazing work for America, then I will have been truly an idiot. So please, please contact me.
Could you just say it again?
Oh, yes. tpark@ostp.eop.gov. I'm also on Twitter at @Todd_Park. And if you actually have a question you think everyone could benefit from, then just ask me over Twitter, and I'll just answer that way, which would also be great. So I'm so excited that you got up and showed up at 8:30 in the morning for Paul and the Drucker Center's amazing hackathon. I know you'll do amazing work. God bless you for doing it. May the force run strongly in you as you do it, as I'm sure it will. And God bless the United States of America. Thank you so much.
Can you turn? Yeah. It's really obvious why I wanted to invite Todd to give this talk. And it's really obvious why his presence has made such a big difference just in the past 2.5 years when he was CTO for HHS. And my wife always asks, why I spend so much time in DC. It's the privilege of working with people like Todd. It really, I can't describe, it really reinstills that belief in government, what the power of government can do. I mean, all the campaigning notwithstanding, the government's not filled with people like Todd, but people who Todd works with, and the ability of Todd to shape the nation and do good is just incredible. And so that's so uplifting, and thanks so much, Todd. Thanks.
You.
So I want to open it up. We do have about 10 minutes. So if there are people in the audience who want to either offer a comment or ask a question, I think you'd be happy to answer.
Hello.
Hello, hello. Wonderful speech. Thank you so much. At the risk of getting in trouble with your wife, can I suggest that we make you the CTO of the world? And rather than just being, the serious point is that Asia and Europe are well ahead of us in terms of the aging issue. So I'm just sort of wondering if you've been thinking about that from an international perspective as we try and get ideas of all the best people and the smartest people don't just live in the US.
Oh, what a fantastic idea. That's a great idea. Again, most of the smartest people don't work for any one organization like you. That's a great idea. So actually, one of the things that's happened recently that may help spur that, might be a platform for that, is the UK has reached out to us and wants to do bilateral summits. The President and Prime Minister Cameron announced this a couple weeks ago. 2 bilateral summits on open health data and open innovation to help improve health and healthcare and spur entrepreneurship and create jobs and all kinds of good things. And so we have our first bilateral summit in DC, June 5th and 6th. A delegation of folks from the UK are going to come to the Health Data Palooza and marinate in American awesomeness. And then we're going to actually sit down with them. And they've got a ton of ideas. They've been doing a ton of fantastic work in the UK. And maybe that could be the beginning of something interesting. Also, the President, a year and a half ago, at the UN announced the creation of an open government partnership where a bunch of countries around the world have linked together to actually commit to the whole notion of open data and open innovation, including focus on health and healthcare. And that could be another great platform to have that kind of conversation. So I think that's brilliant. Yeah. Yes, ma'am.
Thanks for your energy. It's very infectious. I'm with Family Caregiver Alliance. I've worked with them for a number of years. We have had a number of contracts with the Administration on Aging. And I'm curious to know how you work with the cool technology stuff that you're doing with the other administrations to help carry out the fast part of what you're doing with the tech stuff, with the human, slower part of what you're doing, the people-to-people interaction and support.
Yeah. No, so I think, it's kind of a weird thing for a CTO to say, but in my experience, technology by itself solves virtually no problem. It's definitely not a panacea, not even close. It's an incredibly helpful facilitator of humans solving problems in all kinds of new ways. And so I think that you actually have to think of application of technology in the context of people change, culture change, process change, business model change for it to really have an impact. So one of the things that's actually really exciting to me about what's happening with the Administration on Aging, right, is that AOA to me is like this heroic agency that no one knows about, right? I mean, it was created at the same time as Medicare, like nobody knows about the AOA, right? Which is even more ironic because what the AOA does is it actually works with a ton of heroic organizations across the country to help the elderly age well at home, right? And if you actually do that, seniors are a lot happier and they're healthier and they don't need as much of the kind of healthcare services that you need when you get sick that Medicare pays for, right? So what's happening now is that you're beginning to see the healthcare system embrace AOA in a really interesting way, right? Because incentives in the healthcare marketplace are shifting, right? So that health systems and healthcare providers are now responsible, right, for reducing readmissions, for actually proactively managing health of their populations, right? And so, like for example, in a bunch of the care transitions work and population health work, there are area agencies on aging that are partnering with health systems to help make that happen, right? Which makes all the sense in the world, right? Like the health system says, well, how am I going to do? There's this agency, it's been around forever, deep roots in the community that has a lot of experience working to help seniors age well at home. Fantastic, right? So I think there's huge arbitrage opportunity actually, but bridging the world of the human services and health services systems, right? So they work together. And one kind of small example about how data can help there is we have a directory, the Elder Care Locator Directory, that the AOA has published, which is pretty basic, not sort of super detailed, but it's got a lot more information in there than nothing, right? About what kinds of help are available via the area agencies on aging across the country, right? AOA, as part of Health Data Initiative, recently made that data, which had been available on a website that virtually no one knew about, unfortunately, right? They made that data downloadable in machinable format, right? And you're starting to see electronic health record companies, discharge planning system companies who work for hospitals, right? Case management systems, import that data into their systems so they can actually do things like say, you know what, there's Meals on Wheels available in this area, I can connect you, right? And so it's a way of using data to help kind of at the point of care put human service solutions in front of the discharge planning nurse or case management nurse to help actually connect the dots, which everyone's now incented to do, which is fantastic. So does that help?
Yes.
Okay.
Jeff Johnson, Wiser Usability. So government releases this information, makes it available with APIs. The private sector goes out and creates a lot of apps and alters services, and that's great. So the question I have is, for those of us, I consider myself a political activist as well, who've been working for years and years on things like Medicare for all, otherwise known as single payer, or at least public option. Should we stop working on those things and just sort of say, that's dead, let's move on to this stuff? Or should we keep working, pressing for Medicare for all? And
so I think kind of in a nutshell, I mean, the country is capable of doing multiple things at once, right? And I think that all kinds of entrepreneurship and activism are critical to advancing the future of the country. So I don't think there's a single silver bullet for anything, right? I think that actually, for example, the liberation of this data and its use by innovators to produce all kinds of useful services, programs, and benefits is important, right? But it's, for example, not a substitute for the Affordable Care Act and the expansion of coverage to lots of people, right? I mean, all of those threads really intertwine together, right? Because if you think about the health of the country and what drives it, and what drives the success of the healthcare system, I mean, it's really a complex nonlinear system, right? And there are multiple, I think, simultaneous threads of effort that you have to engage in to get to a place where Americans have the access, quality, health outcomes, affordable health care that everyone needs to have. And so what's very exciting to me right now is that multiple of those threads, more threads than at any point previous in my lifetime, or my father's lifetime, right? More of those threads are moving forward at a velocity that's faster than ever in American history, and intertwining in all kinds of magical ways. And so I think progress needs to continue on all those fronts in order to make sure that we get to the place we want to be. But I think actually we're headed there. I think the momentum is fabulous, but we can't let up. Nobody can let up, okay? Everyone has to keep putting pedal to the metal and just running as fast as they can, right? Linking arms with each other to actually invent this new future. But I think we're well on our way. Oh, hello.
Thank you for coming on to us. Sure, a lot of us are thinking in many new ways about changing healthcare. I wanted to ask you about something that you haven't mentioned much. I know that the healthcare law, which is providing a lot of incentives for the hospitals to change, is currently undergoing some questioning in the Supreme Court. How do you think, if at all, an adverse outcome in the Supreme Court will affect these efforts?
That question is substantially above my pay grade. I'm just a geek. I'm not a lawyer. But put it this way, I mean, we're moving full speed ahead on every front, and we're very confident of ultimate success.
Hi, this is Joseph Wei. I'd like to find out what you have for breakfast for that amount of energy. We're going to need this weekend.
What's that?
What do you get for breakfast?
Question about, I understand you mentioned earlier about technology for the technology's sake. It's not going to make any difference. But fundamentally, if we don't have companies developing these iPads, iPods, and the cloud computer, the wireless network, right, fast-speed LTE network, then some of these problems is still very difficult to
absolutely.
solve.
I'm a huge believer in technology as a helper, right? I just don't think that single problems in health and healthcare can be unilaterally solved by technology alone without people. Right. Or without culture change or process change or business model change. But I'm obviously I'm a huge believer in tech as a helper, no question. Yeah.
I'm just wondering, as far as these helping devices or technology, what do you see as the most important piece right now to help solve some of the critical healthcare problems? In terms of faster network, bigger data, what area of technology that you think is still weak?
Really, really good question. I don't know that I'd single out any one component versus any other. I mean, mobile, cloud, the web, obviously, which still hasn't fully penetrated healthcare in terms of its usage. There are so many technologies and so many new approaches to technology that are incredibly powerful. I would hesitate to pick one. And I think actually another danger of picking one is that you then revert to a technology-centric mode of thinking, which many failed efforts to help healthcare technology have been characterized by. Basically, you become a do with a hammer, like looking for nails, right? And I think what's really important is to remember that healthcare is ultimately about patients. And there are problems that they have, and there are problems the system has serving them. And I would start with that. I'd start with a patient-centric view and then work backward and say, okay, if I'm going to solve an actual problem that a patient, that a citizen, a consumer has, or a problem that doctors or nurses or others, families, caregivers have helping them, right? What do I need to bring to bear to do that, right? And not just technology, but also knowledge and people and networks. Like, what do I need to actually get this useful job done? And then think about what technology can best help you do that. I mean, that to me is the recipe for success. It also actually means that you're much more likely to develop a strong business model for what you're doing because you're actually solving a problem, and that's valuable. Someone should be willing to pay for that, right? So, you know, in my experience, for example, in previous companies, you know, there's not a single doctor I knew who got up saying, you know what I really want is a, you know, Linux, Oracle backend, Apache Mod Perl, web-based, ASP, cloud-based practice management billing system, right? That didn't even, it's like, I want to spend more time with my family and my patients and not fight with insurance companies as much. Yeah, so we ended up using all those technologies to help him do that, but a lot of other things. But the key thing is we took a need-centric, customer-centric view of what you're trying to do. And so for every one of you who's actually going to be competing in this challenge, I highly encourage you to do that. The other thing actually, one more tip. This is empirical data, because I love data, all right? I've been noticing that the people who tend to win these challenges and codathons marry the best of all worlds. They're comprised of strange bedfellows, right? They've got like a doc, a patient, a hacker, and a health policy person. They got someone who spent their entire life in public health and someone who hasn't, right? And they combine forces and they do things as a human mashup that none of them would have done by themselves. And so if you're going to maximize your probability of winning Paul's challenge, I suggest you find the people, embrace Joy's law, find the people that know everything you don't, right? And team up with them, because you'll have a huge edge, you know, over the people who are just essentially kind of experts in one given mode or medium to the exclusion of others.
Sorry for the people who are still standing. We're going to finish this section of the program and thank Todd again. We have just a small token of our.
Oh, actually, I'm not allowed to accept it.
It's less.
Give it to Eric. He's allowed to accept it. Then keep it.
All right. Would anybody like it?